Hello everyone, good morning or good evening wherever you are. My name is Kara from USC International Academy. It is so nice to meet all of you today here. And welcome to our webinar featuring Dr. John Wilson and Dr. Rima Habri. Today's topic is compelling combination of population, health, and place. Before starting speech, please allow me to go through some introduction about our guest speakers today. Welcome, Dr. John Wilson, our friend, the professor of sociology and spatial science in Dana and David Dornstaff College of Letters, Arts and Sciences at USC, where he directs the Spatial Sciences Institute as well as the Wilson Map Lab. He also holds appointments as professor in School of Architecture in the Keck School of Medicine of USC's Department of Preventive Medicine and in the Viterbi School of Engineers Department of Computer Science and Civil and Environmental Engineer. At the same time, John is also the professor of Institute of Geographical Sciences and Natural Resources Research at Chinese Academy of Sciences. Welcome, John. And welcome Dr. Rima Habri, an associate professor of clinical preventive medicine in the Division of Environmental Health at USC Keck School of Medicine. She is also an associate professor of Spatial Sciences Institute in the USC Dornstaff College of Letters, Arts and Sciences. We also have Susan, our friend, the managing director and lecturer. Welcome them. We are very lucky and grateful to have them with us today. And dear audiences, please know that we will have the Q&A part of the speech. You can enter in your questions at any time in the Q&A box located at the bottom of your screen. We'll try to get to as many questions as we can at the end of the speech. Okay, without further ado, please join me in welcoming our speakers. Thank you.
Thank you. Can you see that? Maybe not. What did I do wrong? Share screen. Yep. Now you can, right? Yep. All right. So good morning, everybody, or good evening if you're in some other part of the world. I see a couple of people that are looking at our PhD program that live in North America. So I know there's some evening as well as morning people here. So I want to talk about the combination of population, health and place. And to do that, we're going to cover 4 topics. The first is I'm going to talk about spatial sciences as a field of study and a body of knowledge and skills around which one can build a career. I'm then going to talk, then Rima's going to talk about the emerging field of exposure sciences and how it documents the health risks of indoor and outdoor environments. And then she's going to hand it back to me to talk briefly about the emerging field of geodesign and how that connects the spatial sciences with design, planning, and the health sciences. And then I'm going to conclude by saying just a few words about the interdisciplinary PhD in population, health, and place. And the image here is the cover of the Spatial Sciences Institute brochure. And fundamentally, this is what we're all about, creating a better world. And so the goal is to train young men and women with the required skills and methods and data so they can go out and help create a better planet for us and everything else about the planet as well. So let's start in with spatial sciences. So as I said, this is a field of study and body of knowledge and skills around which one can build a career, and the opportunities here are exploding rapidly, given a variety of things that are converging. So many of my colleagues around the world, when they talk about the spatial sciences, would tell you a story that something to the effect that this is a field that combines the multidisciplinary fields of scientific study with geospatial technologies, including things like geographic information systems, global positioning systems, and say remote sensing. So I've got 3 pictures on this slide here. At the bottom left is a picture, looks like flies circling the Earth, but it's supposed to signify satellites. And these particular satellites provide the global positioning system. The Russians have a system, the United States has a system, China has a system, the Europeans have a system, Japan has a system. So there are now lots and lots of satellites in the sky, and they provide precise positioning literally across every part of the Earth's surface. Our ability to imagine and to drive autonomous cars in part relies on this kind of technology. And this has been around now for 20 or 30 years, and it's a game changer. The picture at the top is a magazine cover, Small Satellites, Big Data. And satellites are just part of the big data story, but the big data story is largely about the fact we increasingly live in a digital world. All of our transactions are recorded digitally, and that generates way more data than we could possibly handle if we dealt with it the way I did when I was an undergraduate. Put it on a floppy disk, store it, and keep it until later. Every minute you'd get more data in today's world than you could possibly use, even if you had a modern state-of-the-art disk to store that data on. And then the picture on the bottom right is a picture of a geographic information system. And I left this to last because it's about hardware, and it's about software, and it's about procedures, meaning methods. And increasingly they're all networked. And so increasingly you do this with on the web, online, using the cloud. But the key ingredient here, and the one that most people speak about, is the people part. These software systems don't drive themselves. You have to know what you're doing. You have to have a reason for doing something. And until you get all that sorted out, GIS is, or computing generally won't be of much value to you. Now, I told you what my colleagues often say about the field. What I would say is that everything I just said is true, but I would rather talk about what the spatial sciences are and what they mean and why they're important using something like the story that I'm going to tell with this slide. So rather than focus on the ingredients of a spatial sciences education, what would a spatial science graduate leave with? Well, per the last slide, they'd possess an advanced knowledge of these technologies, experience in the interpretation and processing of satellite images, as well as other digital data streams, a broad understanding of computer applications and database management. I would argue all of those things are necessary, but they're not sufficient. What you also need to be a qualified graduate, a valuable graduate, would be a detailed knowledge and understanding of the spatial principles and methods used to characterize the role of location in the functioning of the Earth and everything we do here, meaning here on the Earth, above the Earth, under the Earth, right? So that's a tall order. And so the reason why graduates of spatial sciences programs are in high demand is because they can do a lot of things. It doesn't have to use computers. The picture on the left here is somebody preparing some plans for how you would turn some countryside into an urban center. And they're using all the tools that I would use with a computer. So they draw different lines and dots and areas and different colors and so forth, but they're using colored pens and pencils, and they're doing it on top of a piece of paper. They didn't need to use a computer in this case, and any of us could still do this. The problem is it doesn't scale. And then the picture on the right is actually a man that was just in the news the other day because he's just written his first new book since he was awarded the 2017 Nobel Prize in Literature, Kazuo Izaguro, and he's Japanese, and he won this Nobel Prize for Literature. And for all I know, in order to write his work, he used Microsoft Word. So that was the software. But to my point, that it's the ideas that matter. It's knowing how to do something and being able to execute something with or without software that's the value-added proposition here. So we want to keep that in mind when both Rima and I think, are talking. And the last thing I'd say as part of the introduction here is that the real value of spatial here, well, there are two parts of this. One is connected to Rima, and one's really just about what's on this slide. Spatial connects the local and the global. So this image here, this brilliant image of China and other parts of East Asia, the Korean Peninsula, Japan, parts of the Pacific coast of Russia, for example. This is a nightlight image, and in this case, these images paint an accurate picture of China's gross domestic product. Lots of scholars have been using images like this to chart the rising power and modernization and industrialization of China, and not just how much there is, but where it's happening and what intensity and so forth. And the picture at the bottom right is a picture of Barcelona. And at the end of today's presentation, I'm going to talk about car-free superblocks and to give you a sense of how they might save hundreds of lives. So spatial connects the local and the global, but more than that, spatial connects the local and the global with lots of other domains. And so when you look at the UN Sustainable Development Goals, you know, some of them rotate around climate and climate change, some about fresh water availability, some about the biosphere and species extinctions and things of that nature, and many around human health and equity and inclusion, these kinds of topics, right? And we need to understand the local and the global and to be able to connect the two to tackle any of those kinds of issues, because they're pervasive, they happen everywhere, they're all interconnected, and we have lots of work to do to understand them so that we can figure out interventions that would turn the problem around so that the problem is solved. So what we're going to do this evening, since it's a very important part of the nexus of population, health and place, is I brought one of my distinguished colleagues, Rima Habra, with me, and she's going to talk about the exposure sciences. And fundamentally, this is the study of human contact with chemical, physical, biological agents or other health risks that occur in our environment. So Rima, I'll let you take over from here.
Thank you so much, John. Let me just make sure. I don't believe I can move the slides just yet. Okay, now I can.
Okay.
Thank you. So just to follow on what John was saying is that, you know, in spatial sciences, in these fields that we're working in, we are trying to understand impacts to human health, whether that's through the biosphere, through air pollution, through the environment. So this field of exposure science is really kind of my specialty, and where I do the majority of my work is exactly that. It's how we understand how humans get in contact with physical, chemical, other types of health risks and agents in our environments. There you go. I think there's a slight delay in my slides, but now they work. So why do we do this? We know that the environment impacts our health, and it does so in a variety of ways. We as humans are exposed to a variety of contaminants, whether that's through the places we live or we work or in our neighborhoods and communities. Some of those include air pollution. That's another big part of my work, and air pollution spans indoor air pollution as well as outdoor air pollution. That could be water contamination and poor hygiene and sanitation. We are exposed to chemicals through consumer products that we might use, through our food, through the air that we breathe, radiation, a variety of contaminants and health risks through the built environment as well, through climate change. But a key aspect to how the environment impacts our health is understanding how we are exposed to these factors. So that's why exposure is really key. And when we think about exposure science, or really trying to characterize exposures, really we think of the human body as a person. Ideally, we are trying to understand how our body is in contact with all these different agents. So the concept of the body boundary is very important. We don't just want to measure things or estimate things anywhere. We want to really understand how we are getting in contact with them. And so what are some of those major questions that we ask in order to understand exposures? What is a big one, right? What are those agents? Are they chemical? Are they biological? Are they physical? Is it one agent at a time? Is it a mixture of things? Because that all really determines toxicity and hazard, right? And health risk. We also want to understand the how piece of the equation. So how do these contaminants travel through the environment? How do they move to eventually get to humans and impact them? And then how are humans exposed to these? So what are those exposure routes? Are we drinking these contaminants through ingestion of food or water? Is it through inhalation, like in air pollution? Skin contact, like in some consumer products? And a very important question is how much as well. So other than the what and the how, it is the how much, right? So there's an element of quantification in all this. And usually that involves some measurements, but also some modeling. And then a big part of this, and a very key aspect in relation to what we're talking about today, is the where element, right? So space and location is a very big component of understanding exposures. And so that could be on a global scale when we're talking about issues like climate change and air pollution, perhaps, but it could also be on a more local scale at the city level, at the neighborhood level, where we live, where we spend our time. And it could even be at the microenvironment scale. So indoors, in our homes, in our different rooms, how do they behave? What are we getting exposed to? And finally, a big element as well is time. And obviously space and time are always interacting. So these are not two separate entities, but when we think about time, we think about when are these exposures occurring and how long, or what's the duration, and how often. Is it a one-time type of exposure? Is it a repeated kind of exposure? And especially when we think about life course epidemiology, or trying to understand, for example, whether certain sensitive windows of time exist for exposures, we are really thinking on the long-term scale here. So for example, babies during pregnancy might be exposed in utero to certain chemicals that might impact their later life development, health, and functioning all the way through adulthood. And so other than these kind of big questions that we try to ask, what are some of the tools or the methods that we use to understand exposures? And these range, these range from the population level, so trying to assess things sort of at a large scale for groups of people, to the very individual level or the personal level. The more we are approaching individual level, this is kind of the gold standard, what we are always hoping to do, right? The more we are gaining granularity or spatiotemporal resolution, in other words, the more we are gaining accuracy in really understanding what that person is exposed to, the more error is dropping. But a lot of the time, cost is also increasing, and burden on the participant or the person we are studying increases. And so there are all these issues to balance, but most of the time we are using a variety of measurement and modeling tools. And what I hope to show you in the next couple of slides are different applications from my work on how we do sort of exposure science, or how we try to understand environmental exposures at the population level all the way down to the individual level. Now, despite the individual level, I'm sorry, my slides are not cooperating.
You want me to try? No, there you go.
Thank you, John. And so despite things generally being more costly or burdensome at the individual level, we are seeing very quick advances in sensor and mobile technologies, in crowdsourcing of data, in machine learning, big data methods. So these limitations are quickly changing and evolving. So let me show you one example of work we do in environmental health to try to understand air pollution exposure and how it impacts human health. So on the left side here, you see an example of maps of California, especially in California with climate change. We have a lot of wildfires. We're experiencing a much greater frequency and intensity of these events, and they impact health, of course. And so we try to use remote sensing data, as well as machine learning data and physical chemical transport models to predict how much smoke is coming from wildfires and how much is that contributing to overall air pollution across California. But on the right-hand side here, you see an example where we can get even more granular and look at the hourly level, for example, within Los Angeles. And so you see the map that's higher up on the top is 9 a.m. in Los Angeles versus 11 p.m. And we can also try to tease apart or model the impacts of traffic, for example, and rush hour on air pollution levels to try to understand health effects. Another example that might be more at the population level or sort of the larger scale is understanding environmental health disparities. And this is work that we do in our Madre Center, where we are recruiting pregnant women from within neighborhoods in Los Angeles that you see here on the map. And so the darker brown colors are neighborhoods that experience a much heavier pollution burden from a variety of toxic releases, the air pollution, to contaminants, in the built environment. And the blue outline are these neighborhoods where we are recruiting these pregnant women that also happen to be lower income women that are experiencing the worst obesity rates and susceptibility factors. So we try to overlay these factors to understand how they really impact the baby's health during pregnancy and once they're born, and their growth after delivery, but also how these impact the mother's health, especially in the postpartum period. And perhaps not surprisingly, but we are also seeing that these same neighborhoods that are experiencing these disparities and exposures are also experiencing the highest rates of COVID-19 right now in Los Angeles. Now, moving more towards the personal or individualized level, this is work that we're doing with two of our wonderful PhD doctoral students, and you'll learn more about this program when John speaks about it next. We also use very high resolution GPS tracking to incorporate mobility into our exposure assessments. So typically we might assume in large population studies that people are stagnant or static, they don't move around. But the reality is we know that people are always moving and they are experiencing perhaps adverse exposures through these activity spaces. And so we are developing methods to try to incorporate that information into our studies, especially understanding pregnant women's lifestyles, behaviors, physical activities, and exposures. Another example of how we do things at the very individual level is personal air pollution monitoring. So again, in these studies of pregnant women, we might deploy sensors or instruments on in special purses on a person's being, actually, to measure air pollution that they are breathing. And we end up being able to basically assess at very high resolution concentrations of these pollutants and how they change over time during a given day or over pregnancy. We can pair that with GPS to understand, again, mobility and exposures within neighborhoods and spaces that they spend time in. And we also can pair that with smartphone surveys and do more detailed assessments, for example, with filter measurements of chemical composition to try to understand toxicity some more. And the last example I'll show you is from our work in the Los Angeles Prism Center, where we designed an informatics platform that integrates sensors and wearables that communicate via Bluetooth in real time and wirelessly to measure things like air pollution exposure and medication use of inhaler sensors and lung function in children who have asthma, with the goal of integrating all this data in space and time and trying to predict when a child might have an asthma attack and what are those triggers that are causing that attack. And so here I have some links for more information if you're interested on these methods. But I hope this overview basically of population level to individual level methods and tools and technologies really has kind of shown you or made the case for how exposure science is really integral for us to try to understand all of today's big issues, from environmental health to population health, from a very local to a very global scale, with the ultimate goal, of course, of mitigating and preventing these harmful exposures and health risks. So with that, I'll turn it over to John. Thank you very much.
Thank you. So the idea that spatial extends from local to global, it also needs to in my opinion, to extend to multiple other domains, right? Because otherwise it's just a bunch of people with some really exciting data and methods talking to each other. And so largely the population health and place PhD program somehow was my idea. I was the person that got it approved, and we're about to graduate our first student. The program's been going now 5 years, so we're super excited. And in general, just like with the two examples that Rima highlighted, all of our population health and place students are doing groundbreaking work, right? Which involves integrating various facets of public health with a detailed understanding and use of spatial methods, and often, in thinking about things across the life course, which is where the population piece comes from. But we're not satisfied with just that outcome, because what we want to be able to do is to motivate and train people so that when they graduate, they can go out and assume the role of leader and lead in helping to change the world. And in some ways, I think in many cases, we've taken a wrong turn. And so what I like about geodesign, because in spatial sciences, we also have an undergraduate degree in geodesign, is that it provides a path to connect the spatial and exposure sciences with planning and design. And if you employ that combination, then you have the opportunity to dream about and imagine and create healthy and sustainable communities. Because in the end, if we want to get to the United Nations sustainability goals, you have to be able to do all this, right? And geodesign is, and the examples I showed are at the local, but they don't need to be. They could be at the global as well. So here's a couple more of our students. These are geodesign majors. And when I think about geodesign, I think about design for a complex world. But again, I really think about spatial plus, because in my head, geodesign is using design, imagining a new future, so design for good. This has been traditionally the purview of architects and landscape architects and perhaps other people, but they've not been multi-scalar. So they think about an individual building, or they think of an individual street sidewalk. I think people need to be thinking of the globe from small to large, from one street to all the streets on the planet, because we need to be able to imagine solutions for all of the problems everywhere. Planning everywhere in the world, China, United States, New Zealand, Europe, is a framework for collective action. Maybe it's a wee bit different in different places, but the kinds of problems that Rima and I have alluded to, these are difficult, complicated problems with multiple causes, multiple effects that help drive what the ultimate outcomes are. And so we're not going to be able to solve them by ourselves. So we need a framework for collective action. And the spatial sciences provide an opportunity, along with the exposure sciences, to make data-driven decisions. So instead of guessing what to do, why don't we use data and try to make sense of the data so that we can zero in on things that perhaps we know will work rather than we just hope they will. And so design might be envisioning cities and communities. Geography incorporates GIS technology and spatial analytics to use data to drive those designs. You have to consider community, because you can't just tell people what's best for them. You have to bring them on board and have them think what's best for them. And hopefully it aligns with a more resilient and sustainable environment and a community. So that's the other piece here. But what I want to show is, before I just tell you about the PhD program, is I'm just going to show you one example. And so this is Barcelona. And the mayor of Barcelona just announced at the beginning of the year that he's going to supersize the car-free super blocks that have sprung up in several Barcelona neighborhoods. And the idea here is that you want to take the real estate away from the cars and give it back to the people. And when you do that, you have opportunities to plant more green cover, which is going to take more pollutants out of the atmosphere. You're going to reduce the use of private cars, at least gasoline cars in particular, And so that's going to reduce the emissions that Rima was referring to. And you're going to give more real estate back to the people to do what they want. And we're going to try and encourage them to adopt more active lifestyles, to use their bicycles, to walk, to hang out, to recreate, to meet their neighbors. All of these things all around the world have routinely been good for health. Now, what's really clever about this idea is you can achieve a great deal with just small interventions. And so on the left here is the street configuration across much of the city of Barcelona and across many cities and probably Asia as well as North America and Europe, where you have alternating streets that are all directing traffic in one direction, one way. This 20, 30 years ago was seen as the solution for moving people quickly and efficiently across a city. The picture on the right is the super block. And what we've done now is we've taken a 3x3 block and we let people drive to their own house by coming in either on the west, east, north or south sides of these major arterial streets. But you can come in and you can go out. Within the 3x3 block, you can't drive across it. And so suddenly cars are going slow, there's going to be less traffic, and so you can reclaim some of that roadway and think about other ways to use it. For gardening, for recreation, for a basketball hoop, for tables, so you can play card games, for dancing, which is a super popular thing in parks in China, right? So there's a million things you could do if you could just get rid of some of the cars. And this is a model that's proven that you can do that. And there are now lots of studies that have looked at the health benefits that follow the first few attempts to do this. With some of my students, we're trialing this idea now in Los Angeles. And in Los Angeles, about 30% of the city's surface is used just for roadways. And so if you're looking for an easy place to reclaim some space to make the city more vibrant, more healthy, more livable, then the transportation land uses are an obvious target. So to this population health and place PhD. By design, it's interdisciplinary. And so by design, the students that are accepted to this program are going to take classes in demography. They're going to take classes in some facet of public health, epidemiology, environmental health, biostatistics. There's a number of opportunities. And they're going to take some classes in the spatial sciences. They're maybe not going to become an expert at all three, but they're going to have a working knowledge of two and perhaps become an expert in one, right? Whether that's good or bad for a person depends in part on their backgrounds. Even more than that, it depends on their interests. And even more than that, it probably depends on their aspirations, right? People don't have to have a degree in any of these fields, demography, public health, or spatial sciences, to be a viable candidate for the program. But it's likely their background and their interests and their aspirations are going to drive the kind of dissertation topic that they're going to pick, right? At least I hope it would. Students typically, we hope, take 5 years in this program. They're guaranteed 5 years of funding. Two of those years are fellowship years. The other 3 are either as a teaching assistant or a research assistant or some other kind of competitive funding opportunity. And when you're admitted, you're not assigned an advisor. And so the first year or two, we want you to explore the university so that you can consolidate based on your background, interests, and aspirations, what you want to do and who you want to be when you graduate. And then we'll let you use the resources of the university within some limits to organize 2 co-advisors, one from 2 of these 3 fields, and then a thesis guidance, a dissertation guidance committee, so they can support you through the whole process. When you do that, given the way the interest in the degree is configured now and how we've organized it, you have the opportunity then to work with colleagues that come from the USC Dornsife College of Letters, Arts and Sciences. They might be sociologists, they might be spatial scientists, but there are many other fields as well. From the USC Dorp Peck School of Social Work, the Keck School of Medicine of USC, where Rima and I both have faculty appointments, and the USC Leonard Davis School of Gerontology. But I could imagine too that a particular person could come along and we might soon find ourselves working with some colleagues from the Gould School of Law or perhaps the Price School of Public Policy. And so the goal is to build a big tent, invite everybody that wants to play to the tent. And as long as we can create win-win opportunities for everybody, then everybody's going to keep coming back to the tent and we're going to have a larger and larger community. If you're wondering how I got to this place, when I was an undergraduate in New Zealand, I was given in a class the Geography of Life and Death to read. It's a little book here that the cover's on the left there. The book was written many, many years ago. And when you read it today, in some senses it's outdated and it's kind of peculiar in how it talks about certain topics, not very fashionable. But for me, that was a game changer. That idea had stuck with me my whole life. And in this PhD program, I teach the first class and it has the name, the Geography of Life and Death. It's a very ambitious topic. And on the right, just to give you a sense that there are lots of people interested in this field. There are many, many journals that people in this field would publish in or think of publishing and reading. But one in particular, the International Journal of Health Geographics, has grown from a very modest beginning into a major journal that often publishes papers at the intersection of demography, public health, and spatial sciences, or the other terms I used. Whoops, what's happened? Now I can't change my slides. And so with that, I think we'd like to stop and take questions. If you're interested, there's the information on this slide for Dayron and Ken Watson. They're both academic advisors in spatial sciences and for the Population Health and Place PhD program. And we've put the contact information for both Rima and myself there in case you want to follow up with one of us. So for now, though, we'll use the rest of the time to answer your questions. Thank you.
Thanks so much, John, and thanks so much, Rima. And the exposure science links human and ecological behavior to environmental process in such a way that information generated can be used to prevent future advice exposures. It helps us to better our world and its ecosystems and inhabitants. Thanks so much. I can say I saw our audiences already have some questions in the chat room. The first one is from DY. And his or her question is, if I want to pursue this PhD program, what are the essential knowledge and skills I need to obtain to prepare myself better?
It's a good question. I think you'd want to be ambitious, forward-looking. You need to have an undergraduate degree. Possibly, sometimes you're better positioned if you also have a master's degree. Rima and I have both been on the admissions committee, and so there's no particular background that you need in order to be a competitive candidate for this PhD program. So sometimes a person has a Master's of Public Health, MPH degree. Sometimes they might have a planning degree or a geography degree. Sometimes they have a sociology or a social work degree. But they're not. That's not the whole list. That's probably just where most of the candidates come from. Do you want to add anything to that, Rima?
I would also say that I think we're always looking for kind of the intersection of your interests along population, health, and place. So not that it's necessary probably, but it's always very interesting to kind of come in with inspiration along the intersection of these three domains.
Okay.
Do you agree with that?
Yep. Perfect. The other thing I'd say about the Population Health and Place PhD program, I think we're very modern in the sense that right from the get-go, our motivation for creating the program was that we want to train leaders. Now, leaders mean different things depending on what career track you pick. So in some senses, a scholar in a university can be a leader, but if they have an impact, it's maybe for the most part going to happen after they die. So they need to be in it for the long game. So if you're going to pick the academy as your place to make a difference in the world, then most of the difference you make is going to be expressed in the people that you help to graduate, that then go out and change the world in much faster terms than you were thinking. And so there are leaders today, of course, in government at all levels: local, regional, provincial, state, national, and in the case of the World Health Organization and the UN and these big international agencies. And there are leaders in the private sector, not just the tech leaders that get all the attention, like Elon Musk and some of these great technology leaders in China and other parts of the world, but leaders in public health agencies, leaders in policy think tanks, leaders in software companies that have a big component built around health, like, for example, Esri does in the United States. So we're in that application, we're looking for people to describe what they want to do and to demonstrate a commitment to doing that in a style that would suggest that upon graduation with a PhD, they may become leaders in their own right. And they're going to have a fast impact if, in fact, they succeed at that.
Rima, there's a question in the chat. Do you have any experience or ideas on how to use exposure science to help aging people?
Yes, thank you, Chuan, for that question. Of course, I mean, aging people is a special category, let's say, along age and demographics, but aging people don't start out aging, right? So in exposure science and in our general field of understanding population health and place, we tend to look a little bit earlier in life, let's say, at the neighborhood environment, the kind of built environment, for example. In earlier life, was there an opportunity for a healthy existence? What were those exposures like? We know that air pollution influences, for example, neurological function, is associated with Alzheimer's and Parkinson's disease and the development of all these later life kinds of diseases. But also when you do become in that age category, right, your immediate environment is very important in terms of influencing how you can maintain your function and well-being and health. So for example, elderly people living in communities that support group activities and mental stimulation and social support and provide spaces that are clean and healthy and safe for exercise and maybe for gardening, that is all under the realm of exposure sciences and spatial sciences. And these are all factors that very heavily influence the health of the aging population. So these are obviously high-level kind of ways in which exposure science can be used to understand the aging process and influences on it. But there are so many more.
You're a popular young lady, Rima. Lots of questions here for you. There's one question that shares some suggestions on how we organize our daily life to prevent environmental health risks. I'll answer it first and then you can take a turn. But I've spent maybe 3 of the last 10 years in China, principally in Beijing, but often in Wuhan and other parts of China as well. And so I know it's getting better, but one thing that always struck me, because I'm a non-smoker, is that there's smokers everywhere. And, if one cares about their health and their quality of life, in the long term, smoking is not a good idea. And being around secondhand smoke, not a good idea either. And so that's one very tangible way that we could make a better planet, and we could instill in people a set of practices that might lead to a better quality of life across the lifespan. with that introduction, Rima, you can tell them all the other ways that
I mean, I 100% agree. And I think really this is at the heart of exposure science and everything we talked about today, which is the idea of understanding where and how you are getting exposed to these harmful risk factors, let's say. And a lot of the time, these are not what we assume they might be. So for example, in our field, people tend to think a lot about outdoor air pollution, but they completely maybe forget or underestimate the importance of the indoor environment, right? And now with COVID, when we're all spending so much time inside our homes, we're really starting to appreciate how the air quality in your home and all these activities you do and where your home is located relative to neighbors that might smoke or loud roadways or pollution events, or even neighborhoods that are unsafe, how all that is impacting our health. So I think step one would be to step back and actually recognize, where are you getting these harmful exposures, when are they happening, and are there ways in your life that you can kind of modify to minimize these personal exposures and risks, knowing that, of course, we will never live in a kind of a sterile bubble, right? We are always going to be exposed to several things, but it's understanding and balancing risk that's really at the heart of this discussion.
Yeah, and common sense is important here. I once helped recruit a colleague to the preventive medicine department at USC, and he's a very accomplished exposure scientist. He was very unhappy at USC, not because of the university, but because somehow he settled on the idea that he'd buy a house next to an airport. And so the whole time he lived there, every conversation I had with him over 6 or 7 years, God damn it, John, that damn house I bought, it's right next to an airport. I thought, dude, you knew that when you bought it, right? So you didn't think it was going to be noisy? Well, not that noisy. Well, I would have thought, just thinking about airplanes, that it's bound to be noisy. So, some of these things that, in low amounts, we probably ignore and don't even pay attention to. If it's loud enough and it's often enough, then it's going to interrupt your sleep. It's going to mean that you don't want to go outside because outside is going to be noisier than inside. And so these can have huge impacts on your quality of life, both in the moment, but then it turns out later in life as well, because, most of the insults that we encounter in life are cumulative. Not all of them, but many of them. And so, over the life course, it maybe just gets worse and worse and worse. Susan, do you have a favorite question for next? You've answered a bunch.
I think there's one about how to protect personal information in the data that you're using.
I can try. I can start, John, on this.
Yep.
Let's spin this one. I mean, I think in all health research, right, we have very important duties and training, right, and systems in place and software and technology to protect personal information. And that is really a major part of any one of our training to be able to do this research in the first place, right? But I think it's very important to also realize and keep in mind, so the way we do this is, for example, we never reveal personal information about our study participants. When we show maps or data or plots, we don't show specific locations that are real participants' homes or, where they've been. We don't share addresses. We have very specific protocols for where data gets stored and who can access it, and kind of several layers of security behind that. But fundamentally, people and humans are at the core of that system that John was talking about, right? So a lot of, if you are going to take on the responsibility of doing this kind of research, a lot of it is your ethics and awareness and kind of constant attention to protecting the data and the confidentiality of these participants you're working with, because at the end of the day, they're actual human beings with actual lives, right? And data is not free. It comes at a cost, and you have a responsibility to protect it. So we think about that a lot, obviously. Do you want to add to that, John?
No, that's a very good answer, Rima. I was going to tackle the next question on the list there, which was somebody's asking whether COVID-19 will permanently change some natural resources that we rely on. So I think I have a paper that's just about to be published with some colleagues from the Institute for Geographical Sciences and Natural Resources Research at Chinese Academy of Sciences. And so we took satellite imagery and some other data sets, and we looked at not this spring, but last spring in China. So, you know, obviously the whole shutdown and then the social distancing and all these different rules were first implemented in China. Then a few months later, they were implemented in Italy and the United States and elsewhere. And so we've demonstrated, I think, that, you know, once China shut down all the factories, then they turned off the emissions. So the air was, there was less air pollution. So there was brighter sunshine and more sunshine hours. And across China as a whole, that turned out to be, spring started about eight days earlier than it had in any of the previous 5 years. So, and, you know, basically the other thing it showed was that perhaps we all thought as scientists, but we'd never had the chance to test, was that if you could change kind of the emissions across significant parts of the planet, you could have more or less immediate effects in terms of how the atmosphere would then respond and how the biosphere would then respond to that changed atmosphere. And so, you know, for people that want to clean up air pollution, and, you know, with other colleagues in the Chinese Academy of Sciences, we've published papers on the largest cities in the world. And, you know, air pollution in most big Chinese cities is pretty poor, but it's even worse in big cities in India and some other parts of Southeast Asia. But this gives us hope that it heads on how to reorganize industry so that we have maybe the same or less output, but in particular less emissions. Then we could return to some parts of the planet to conditions that perhaps we haven't seen for 20 or 30 years. So it's, to me, it was hugely encouraging. It's temporary given current circumstances, but if people were already motivated to clean up industry so that we had less emissions, they should be doubly motivated today based on sort of what we learned during COVID-19. We see similar effects, but perhaps less dramatic across most of the planet, I bet, for the last 12 months.
Yes, thank you, John, and thank you, Rima. Of course, thank you, Susan. I realized some questions from other media platforms have some overlap. And for example, one student or one audience asked that the personal cell phone will be positioning when the institute or system does the pandemic surveillance. I think just now about the personal information, Dr. Rima has already answered these questions. And another audience asked that the most impact on person from environment or place seems cannot be avoided from the individual angle. What can we do to live a healthy life? Dr. Rima, would you want to add some information about this?
Sure. I mean, I think, again, it sort of ties to what we were discussing before, where, you know, it starts, I think, with assessing and understanding sort of the day-to-day risks and exposures someone is experiencing, right? And no kind of two people are the same in terms of what you experience, but also what you can afford, perhaps, the services you have access to, you know, the systems you have access to. So I would say it's important to be realistic in terms of what can and cannot be modified in someone's personal daily life. But it starts with educating ourselves and sort of looking around us in our environment and trying to identify where are we getting potentially some of these exposures and trying to rank them in a realistic way in terms of how much damage they might be doing to our health. Or, for example, if we have someone who's in a sensitive group, for example, someone who is sick, or a child who has asthma, or an elderly person who has COPD, for example, chronic obstructive pulmonary disease, that then gives you a special reason to try to be extra cautious about certain exposures. So I realize this is very general advice, of course, because every person has a different experience, but I would really love to emphasize, and we do this a lot in our courses that we teach in environmental health, that it's really about balancing and evaluating risk, because we as human beings tend to have this kind of fear drive our thinking in terms of risk and exposure. So, you know, if I show you, for example, that if you light a candle in your home, your PM 2.5 concentrations in your home are going to go up to the 400 and 500, people might be terrified. And the reality is that we've been doing that and experiencing that for a very long time. And that's not necessarily the thing that is causing the highest risk in your life, right? So balancing all this information and being realistic sort of about putting things in perspective. I hope that helps. I'm not sure.
Thank you very
The
much.
other part of that answer to Kara to that question is that you also have to take into account the fact that no two people are identical. So in general, for example, many people in the architecture, landscape architecture, planning fields would advocate for lots more green infrastructure. So lots more vegetation in cities. And in general, for most people, many people in cities, that would be a good idea. But if you happen to be one of these people born with allergies, then some of those trees may be the very thing that kicks your allergies into high gear. And so, you know, for 7 out of every 10 people, you know, living amongst, you know, more or less maybe 70% canopy cover with trees would be fantastic. You know, more shade, less heat, less air pollution at the local level. But for 3 out of 10 people, it may be just the worst thing ever, right? But not all the time, but maybe at particular times a year. Sometimes the allergens come when the plant flowers, or sometimes it comes in spring or in winter. And so these are hard things to know. But you know, I think you know, one way a person navigates life is to learn where these stresses are, and then to take appropriate or evasive actions so they can avoid them.
Thank you so much, John and Rima. One audience asked that this question is for Dr. Rima, and you just mentioned the environmental health disparity in age in pregnancy outcomes. The exposure to environmental society and to build environment all have taken women and their babies in risk. Can we build some institute to help them to dealing with this? And how? Would you please give some suggestion about this?
Sure, thank you. That's a great question. So this is fundamentally what we are trying to do in our MADRES Center. And MADRES is an acronym that stands for Maternal and Developmental Risks and Social Stressors, and their impact basically on pregnancy. So I think, you know, pregnancy especially is a sensitive time, right, that we care a lot about, because that is a time when the fetus is developing, when all the organ systems are developing. And so certain windows, especially, and certain exposures that might occur during pregnancy could have really detrimental long-term health effects, right? And not just for the baby, for the mother as well. And as much as, you know, we care about children, of course, the mother and her physiology is going through such a tremendous change, if you think from a cardiovascular health point of view, from an inflammation point of view, from a respiratory health point of view, forgotten in that equation. And so, you know, the way we approach these kind of studies of health disparities is by thinking of both the mother and the baby. And so a lot of the time, you know, what we generally do, for example, in our work is we try to not focus on one single exposure, but we try to take this mixtures approach that I slightly hinted at in my talk, where we try to think of not just sort of the chemical exposures that she is exposed to, not just air pollution and perhaps metals that we measure in blood or in urine or cortisol stress levels, for example. We try to also think of physical exposures, noise levels, we think of the built environment, and we really try to combine social stressors into the equation. So these are factors that might increase someone's susceptibility or vulnerability to these factors that they might be exposed to at the same time. We try to take that all together basically in our health models to predict risk. And so, this is very easy to kind of describe at this level, but obviously it involves a very large team of people, a great dedicated staff who have built these relationships with the cohort and continue to get in touch with our participants, ask them questionnaires, collect detailed location information so that we could do all this additional geospatial enrichment and modeling of the data. And it also involves a large investigative team with expertise along a variety of different domains. So, not just environmental health and exposure sciences and air pollution, but also biology and genetics and epigenetics and spatial sciences, of course, right? And so it's a large enterprise, it's a large effort and team, and we are very happy to be able to now continue that. We're in our 6th year of now funded for a 10-year cycle, but it's definitely a large kind of effort and ongoing work to build these institutes and centers and support them. And I think if you want advice on how to do that in a large institute, I would definitely ask Dr. Wilson here. But that's probably as much, reasonable advice as I can give online in this format.
Yeah, thank you. Thank you so much. And I see one audience asked that the buildings in Barcelona are really special. My major is landscape architecture. Can I apply for the major related to exposure science in USC?
Maybe I'll try and answer that. So Rima and I are both part of something called the Southern California Environmental Health Sciences Center. So this is a center that's been funded, I think, for going on 25, 30 years. Rima and I have not been part of it from the beginning, of course. We've only, well, I'm a Johnny come lately. She's a Rima come lately, I guess. And one of the things we've done for the next round of funding was that we volunteered to stand up a group about climate and health. And so we've brought in people from all across the university, and among those a couple of people from architecture, one from landscape architecture, one from sort of the building science side of architecture. And these people bring, to Rima's point, that you need a whole army of people to make a difference. These people bring really new and important fresh perspectives about what we can do in terms of reorganizing the built environment so that you could do that in a way that you intervene to cut off some of the stresses and the causes for the outcomes that people like Rima find in their research, right? And so, right now I have a big project around the health sciences campus at USC that's looking at the potential benefits of reimagining the urban landscape and particularly the green infrastructure. And so I've co-opted one of the landscape architecture faculty to be a co-PI in that work because they have skills that complement the skills and experiences that I bring to the project, right? So I think if you want to make a difference in the world going forward, it's partly about, how good you are, but it's really about how well how motivated you are and how good you are at forming and participating in teams. And the win-win for teams is that everybody has something unique to contribute, right? So don't be looking to build a team of clones of yourself. You won't get anywhere. You need people that are going to challenge you. The best teams I find are where I think I'm the dumbest person in the team, right? Because then I got the most to gain. But as long as everybody's got something new to contribute, then it's a win-win, I think, for everybody. And so I wouldn't be scared of that. There are going to be some things you're going to do easily because that's your background, and there are some things that will be hard. And we're going to require you in this PhD to do some things in public health and some things in demography and some things in spatial sciences. So you're not going to be an expert necessarily in any one of those, but you're going to have a credible knowledge to bring and combine with all the other things you've learned during your life, that when you graduate, you go out and make a difference in the world, right? I've never taken a class in chemistry. And when I was a student, I thought I was really clever for evading that. I have a science honours degree. I might have the only one in the world where the person didn't take a chemistry class, but it turns out that's the biggest regret of my life, because, you know, the first big talk I gave at a conference was to a room full of about 1,500 chemists. It was terrifying. Now, the work I'd done was only partly about chemistry, but the audience was all about chemistry. And so all their questions about my talk was not about the modeling I did and not about what the model results mean, but how did the model handle the chemistry? And, you know, for me, that was sort of a black box. I had a project partner that was a soil chemist. So where I was in trouble, he helped me out, but he didn't come to the talk with me. I gave the talk by myself. So I guess my story is focus on, take advantage of what you know, and be brave in trying to acquire some skills around what you don't know. And don't be staying within that little safe zone where you take another class in a field you already know well. That class maybe adds 2% to what you already know. Be brave and take a class it's not about anything you know, because that might add 20%, right? So in life, I think risk and rewards are commensurate. The bigger the risk, the bigger the rewards will be. And, you know, life's short, so I'm always in a hurry to find big rewards. Rima is too, I think. That's why I like her.
Can I add a quick example to that? I'm not sure. Do we have the time?
Yep.
Yes, of course.
Thank you. I just wanted to kind of re-emphasize. I mean, John is making such an important point here, and I promise you all, if we have young students listening, listen and take that advice to heart, because really I have two examples to give you. One would be just working with our students in the PhD program. We are quickly learning. So what John did is he brought together all these wonderful faculty from all different disciplines and schools, and we all speak our own language, right? We were not trained in our own programs to speak engineering language, for example, or computer science language. But the real value, it turns out, and the real skill that if you can quickly try to learn or use every opportunity you can to learn, is just know how to talk to each other across silos and domains, right? So I find that our students who are working jointly in these groups are really gaining those skills that you cannot put in one course. And they are really so very valuable, because we don't live in sort of a disconnected world anymore. The world is one place, and it really is. And you can just see from today's talk, right? I'm a native of Lebanon, and I'm in LA, and I'm talking to China and Asia, and right, and John's from New Zealand. And so the idea of breaking down those kind of siloed disciplines and knowing how to talk to each other, that's where really most of the important science and the interesting and exciting science and most of the developments happen very quickly for humanity, at least. That's the first point I wanted to make. And then the second one is more of a practical example to show you how just by us doing what we do, students are finding opportunities to reach out and work with us. So for example, that air pollution hourly model that I presented was a student in urban design who reached out to me in preventive medicine and environmental health saying, I'm very interested in modeling air pollution. And it took me a while to realize, well, but this is not your program, and this is, why do you want to do this? And he wanted to do it to understand environmental justice in how different people commuting to work through transit systems and how we design the urban environment and transportation systems get exposed to air pollution. So literally his whole dissertation research could have been in my program, only he's in urban design and he's thinking about designing transportation systems. So that's why I really wanted to iterate and encourage you guys to stop thinking within these kind of boxes of how we define disciplines and really look at those cross-cutting themes. That's where the fun stuff is. That's it.
Thank you. Thank you so much, John and Sprima. I know our audiences have many questions and would like to discuss further about with our professors. And I will pick the last one in our other media platforms. And this question is from a sophomore student in undergraduate major in geoscience. And he or she asked that if a professor can recommend some books or articles about GIS application technology to him or her.
Well, I think geology is fundamentally about maps too, and about understanding where things are on the Earth. Compared to, I was trained as a geographer, but I worked in an earth sciences department the first 14 years I was an academic, and so in some ways their work is more complicated because I think geologists have a longer record of thinking about the world in 3 dimensions. Typically they think about depth, and they're thinking about sort of the both solids and liquids under the ground, and how they interact with the surface and how they change over time and so forth. So it's both hugely important work and hugely complicated work, and increasingly the kinds of tools that spatial scientists use are now organized in 3 dimensions. Sometimes, the last talk we gave in this series, we were talking about 3 dimensions above the ground in terms of the urban environment and how buildings change the way the wind blows and where it blows, and therefore source and receptors for air pollution and so forth. But we could just have easily have talked about the same tools in the context of the 3D below the ground. So I think you would just use a search engine and look for GIS and geology, or GIS and subsurface, and you will find lots of examples. In many cases, they'll be coupled with modeling and various kinds of model applications. And again, there are physics-based models, there are now AI-based models, and so this is just like all parts of science, it's exploding before our eyes, because we suddenly have a lot more data than we had before. We now have a lot of methods that can handle such big data streams, and it's a super exciting period now in the future for almost every science that I've ever thought I'd be interested in. But I think it applies to the sciences generally, and for that matter, if you're coming from a humanities background, I might offer the same opinion, that in the humanities, the digital era is really exciting as well, because there's just a million ways that you could use some of these computational methods as well as spatial methods to find meaning in your data sources that you couldn't possibly find before.
Thanks so much, John. And our audiences, you can see that Susan has tapped many useful links and information in our chat room. So if you have any interest, you can link the information. Thanks so much. And we have already received many flowers from our other media platforms to our professors. Thanks so much, John and Rima and Susan. And I say it's already 8:15 in LA now. So dear audiences, if you have any questions or further inquiries, please contact our professors after our webinar. And just now the PPT slides just shows the contact information, and you could also go to the Spatial Science Institute website and locate the email address or numbers. The web is spatial.usc.edu. Thanks so much. Okay, thank you, Susan. Okay, everyone, this will be the end of today's webinar. Thanks for attending, and we will continue to have this series of webinars to bring cutting-edge knowledge and insights in different topics to you during this challenge period.